any problems here in coming on, y'all. Do you see the full screen there?
Yes, we can.
Yes.
Okay, excellent. This is our ministry is called the Mustard Seed, and we have Lifestyle to Health. We have Lifestyle to Health, the Mustard Seed. We have Lifestyle to Health, and we do educational training. You can take a picture of that little QR code, and that will lead you to our contact information. One thing you may be interested in, I'll just mention real quick, we have a Lifestyle to Health 30-day program. It's a free program. If anybody would like to do it, it starts Tuesday morning, January the 2nd at 7:45 on, it'll be on Facebook. You just go to Facebook, Mustard Seed TN, and it will be for about 15 minutes each morning. When I used to be director of a lifestyle center, we had people come in from all over the world. And so this is a very similar program. Actually, we're just finishing a program up in Rwanda this week. We do programs over in Rwanda. That's a 2-week program, and this will be a 30-day program. And so if you know anybody that would like to do a 30-day program for diabetes, cardiovascular disease, those more chronic issues, weight loss, stress, whatever, have them join here, and they can participate. If they can't be on at 7:45 Eastern time, they can go back and watch it because it'll be a Facebook Live. So when we look at natural remedies for emergencies, this is a wreck that I actually observed as I was driving down the road, and it wrecked right over in front of me. I pulled in. Would the average medical missionary know what to do? And many times, yes, we know fomentations. Yes, we know how to do revulsive treatments. Yes, we know how to do decoctions and infusions with teas. But do you know what to do in an emergency situation? And I personally believe medical missionaries need to be well ready. An example, today we responded to a call where a man fell off a roof. He was working on the roof, and he fell 25 feet off the roof. He lost his pulse twice. When we finally flew him out of the hospital, he had a pulse again. So, it could be your neighbor falls off a ladder, falls off the roof. Do you know what to do in an emergency situation? And we'll look at some more acute situations here. I'd encourage every one of y'all to take a first aid course, whatever country you're in. I personally believe everyone should know CPR. CPR saves lives. It's a very simple, it works well, and you can get it through the American Red Cross. You can get it through the Heart Association or whatever country you're in. Every medical missionary should know CPR, how to do the Heimlich maneuver. And then part of first aid, you should know how to, and again, you can get this from the American Red Cross. You can learn how to stabilize a patient, how to bandage them. Very, very important of what you can do on the ABCs, airway, breathing, and then circulation, and controlling that situation until someone else can get there who is higher trained in emergency care. So let's take a look. The first thing I'd like to look at is cuts and scrapes. And one of the problems people have is when they move to the country, and I personally believe everyone should not be living in the city today. All of our church folks should be living in the country. And folks say, but Walt, who's going to take care of the cities? Well, as Elder Richard Marker in the Greater New York Conference told me years ago when he had several of us come up to Camp Berkshire and teach about getting out of the cities. I said, Richard, why are you doing? Richard and I were real good friends. And I said, Richard, you've invited every church member in the Greater New York Conference to come to this program. Who's going to fund the churches in New York City? And he said, I said, why are you doing it? He said, because God told me to do this. He said, what's supposed to happen is our members are supposed to move to the country, still come back into the cities and evangelize, fill their church pew, and then that person then moves into the country and they help fill the church pew. We don't abandon the cities, but we should not be living in the cities today. And as we look at the times we're in, no, we should not be in the cities. As people move to the country, they're afraid. What happens if I cut my leg with a machete, or what do I do? Let's take a look real quick. Cuts and scrapes. So first of all, you want to stop the bleeding, and you can do that various ways by and again, the first aid classes teach this, and so I'm not going to go deep into that, but you want to apply pressure, you want to elevate, you want to clean the wound. You can clean it with soapy water. You can clean it with hydrogen peroxide. Now, years ago, when we did wound care, and I still do a lot of wound care, but we used to clean the wounds daily with hydrogen peroxide. But you don't want to do that because you're going to. It's okay to do it every once in a while, but as that new tissue is growing, that hydrogen peroxide will retard that growth, and so you won't have as fast a healing. But initially, you want to clean it with soap and water. You want to use hydrogen peroxide to clean that wound. You can use pine sap. You can use turpentine. Years ago, we used to use turpentine a lot, but pine sap is something I use a lot today. When you use pine sap in a wound, will not grow. Pathogens will not grow in in pine sap, and it also helps the wound heal very fast. The only time you don't use pine sap is in a puncture wound. If you have a puncture wound like a nail puncture, a dog bite, a cat bite, unless you can get into that area and again clean the wound, irrigate it, and in that puncture, that can be difficult to get down in there and irrigate that out. What will happen is that pine sap causes that to heal very rapidly on top, and then you will tunnel back out with that infection. You want to bandage it once a day. Go and change that at least once a day. You want to change that dressing. You can use steri strips for closure. And let's go back and look at what we're talking about here. I like steri strips. Dr. Agatha Thrash taught me how to use steri strips more accurately, and Dr. Agatha would not have done it like this. You have that steri strip and you run it across as it is here, but she had us do X's on there, and that keeps it from shearing. As it is here, it can shear up and down on the left and right side. But if you put your X's on, put your strips as it is here, and then put your X's on there, run it across, it won't shear back and forth. And the question to Dr. Thrash was, how long do we leave the steri strip on? And she said those distal ends, those far ends of the steri strip are going to start peeling up. Don't take them off. Take some little scissors and clip those little edges as they come up. And by the time those steri strips come off, that wound should be healed. Now be careful. You want to cover that area with another dressing, a 4x4 or whatever the size it is, because we don't want it getting wet. We don't want any kind of dirt or whatever getting there. So when you steri strip it, you still then want to bandage it to keep anything out of it, keep it from getting wet, because those strips will prematurely come off. Also, when you put your pine sap on there, be careful. Like this wound here, I would put the pine sap in there with like a little toothpick and dab it in there, but you don't want to get it on the outside areas because it's going to be too slick and your steri strip is not going to stick. You want that steri strip to stick very well. Then you want to clean and keep clean and watch for infection. Very, very important. So you don't just, medical missionary work, this is very, very important, y'all. And this is the most important thing I'm going to say tonight. What is our mission? What is our mission? It's to point the sin-sick soul to Christ. Now, there are those who think a one-time medical missionary exposure is all we have to do. We can do a a health fair. We can hand out literature. That is not how you grow a garden, y'all. You do not just throw your seeds out there and walk away from it and not prepare the soil, not till the soil, not water the soil, not pick the weeds, all during that time. It takes, I believe, evangelism is friendship evangelism. So when you have a situation where a person gets hurt like this gives you an opportunity then to go back to that person on a daily basis, sit with them, pray with them, and whatever treatment you do, you always pray first and ask God to bless it. Because if you think you're doing it, you're going to fall and bust your nose because you can't do it. It's only God that does the healing. And so as you have that opportunity to go back to that person, to monitor for cleanliness, to change that dressing, to monitor for infection. It's a time that you can pray with that person. It's a time that you can develop a relationship with that person. It's a time you can tell them an experience that happened today where Jesus did a miracle. That is why we're out there, to point the sin-sick soul to Christ. It is not to fix cuts and scrapes. It is not to reverse diabetes. It is not to reverse cardiovascular disease. That is not the primary. Yes, we want to do an excellent job at cuts and scrapes and diabetes and cardiovascular disease for God's glory. I mean, we can do a sloppy job and it's, God's not going to bless that. So we want to do an excellent job. But this gives us an opportunity to witness to those people. Immune system. This is the big issue. As we look at acute issues, especially this time of year, there's a lot of coughing in this area. It's going for months. And so what can we do to help people? So number one is stop immune busters. I call them the 3 S's. I had a lady call me today. She has, she's worried about her family getting sick. There's people are getting sick this time of year. She said, Walt, what can I do to protect my family? What can I buy to protect my family? I said, first of all, yes, there's some things you can buy. But number one is you got to get to the cause. Don't just mask and manage with healthy things. Yes, you don't want to use your antibiotics, but, yes, we could use Alimed and Golden Seal and colloidal silver and all these things, but let's not even use those. If possible, let's not even get sick. And how do we do that? First of all, stop the immune busters. There are 3 major things that will take out your immune system. Number 1 is stress. Number 2 is sugar. Number 3 is sleep deprivation. And we don't have time for me to go into the why all this is, but you can watch other programs and see how that is. But no sugar, manage your stress, and get your sleep. That is huge. They will wipe out your immune system. I like oil of oregano. And the key with oil of oregano is in the incipient stage. Just like if someone lights a match and it starts burning, that is the incipient stage. Have you ever in the middle of the night felt like your throat, starting to get scratchy, your nose starting to get clogged up? That's when you roll over and at your bedside table, by your bed, you go and get your oil of oregano and take it, 3 drops. I do 10 drops. Do not do 10 drops at first. You're going to think I'm trying to kill you. Do 3 drops. I do it sublingually under my tongue, chase it with some water. One night, several years ago, I woke up and I knew I was catching something. And my challenge is I'm also a fire chief in our local community. I believe I need to help the local community. I started doing that in 1980. So if I'm out working a wreck late at night, like 2 weeks ago, I worked 3 wildland fires all night long. And I don't do that every night, but there's times I have to. That lowers my immune system. So if I felt like I was catching something, I leaned over to get my oil of oregano. It wasn't there. Mary Lou didn't have her oil of oregano. What did I do? I got up. I drove 35 minutes off the mountain to work, got an oil of oregano, took it here at work. Then I went back home, put it in my bedside table, and I went back to sleep. Because if I had waited till the next morning, there's a good chance it would have got me and I would have gotten sick. Just like Tamiflu, which is 48 hours. If you take Tamiflu after 48 hours of getting sick, it's not going to work too well. The same is true even on the natural side. You want to catch it in the incipient stage. Allimed is a tremendous product. I use it a lot. I sell it to physicians all over the world. It takes 24 cloves of garlic to make one drop. 24 cloves of garlic to make one drop of this Allimed. It's antibacterial, antiviral, antifungal, antimicrobial. It's amazing. Doctors use it for MRSA. They use it for Lyme disease. They use it for H. pylori, the C. diff, SIBO. Because it's antibacterial, it works as like an antibiotic. But because it's an antiviral, it's going to be huge for viruses. I had someone else call me today, and their family had a virus, and the doctor said, well, there's nothing I can give you. It's just going to have to run its course. No, it doesn't. You can use Allimed. You can use a number of antiviral things that God has given us that's going to work. The Golden Seal is another great tool that I like using, Echinacea, but be careful with Golden Seal and Echinacea. You can only use them for just 2 weeks, and then you have to stop 2 weeks because it loses its efficacy. Olive oregano, Allimed do not. Garlic does not. Honey does not. Colloidal silver does not. But Golden Seal, Echinacea, will lose its efficacy. And so you can pulse them. Golden Seal for 2 weeks, Echinacea 2 weeks. Golden Seal 2 weeks, Echinacea 2 weeks. But be careful with Golden Seal in long-term use because it can cause depression, even though you are pulsing it. Usually it's around 6 months, but I have actually had folks go into depression, suicidal within a month and a half. So I like Golden Seal short-term, not long-term. Colloidal silver, another great tool. There's a lot, and I'm going to go. There's many, many more things I could put up here tonight that will work, but I'm just giving you just a few items that you can use that work very, very well. And the cool thing about it is God has given us different things in different parts of the world. So when I go to Africa, there's things in Africa we do not have here, and it works great for the problems they have over there. We have things here and we use what? So God has given us items where we are. I remember someone called me from Jamaica one time, and they said, what do I need to use for this? I said, I don't know. Go ask an old man, an old woman in Jamaica. And in your country, what's up in the mountains, use what God has given you in your mountains. It's very important because not always are we going to be able to get chaparral out of California or out of Arizona. We got to use the tools that I have here in the Appalachian Mountains of East Tennessee. So for pneumonia it can be a killer. So what do we do for pneumonia? One, improve immune function. You got to improve immune function. Improve gut health. We're told that 75% of your immune system is determined by your gut health. Very important. Probiotics improves that gut health. Allimed's going to improve the immune function. Turmeric's is an anti-inflammatory. That's going to help. Exercise, if possible. Exercise is going to improve your immune function. And you may say, "Well, Walt, I'm in bed. I can't get up. I'm sick." Well, can you clap your hands? Just clap your hands. That's going to increase circulation. Rub your ears. It's really good to rub your ears. Pat your arms, pat your legs. That's going to give you micro circulation. Get moving. Even if you're bedridden, if you're in a chair, if you're in a wheelchair, you can get moving some, unless you're just plumb sick. Manage the fever. Move and turn the patient. Very important in pneumonia. And actually, a lot of times people get pneumonia because they're not turned when they are bedfast because they're sick. You've got to turn that patient every 2 hours to keep from getting pneumonia. Manage the coughing. You can use broncholine. I like broncholine. During COVID pneumonia, we helped many people all over the world with broncholine. Excellent product. It has various herbs in it, but it's the best cough syrup I've ever found. Eucalyptus is what you can do is some people will use albuterol. During COVID, people were having problems breathing. They needed a bronchial dilator. Mullein is an excellent bronchial dilator. It's the best herb for the lungs, but eucalyptus is another great one. A surgeon taught me this years ago. You take a nebulizer, fill it up to the line with distilled water, and you put in 4 drops of eucalyptus pure essential oil. You may have to put a drop of trace minerals or 2 little kernels of salt, because you've got to have enough mineralization for the electrolysis to take place in the nebulizer. But this process, eucalyptus in a nebulizer, works better than albuterol, and it's a great product. And you don't have to worry about cramps, or there's a number of side effects with albuterol. Lobelia is another one to help manage coughing. If you just have a dry cough and you're not having a productive cough, I believe in productive coughs, you got to get it up. But if it's a dry cough and a person is just dry hacking all night long, they're not getting their sleep, use lobelia. You can put about 30 drops of lobelia under the tongue, hold it for 2 minutes, and swallow it. Lobelia on low dose is an antispasmodic. On high dose, it's a spasmodic. So you can take a 1 ounce bottle of lobelia, chuck that thing, and you will not make it out of the door in the room. You will throw up like syrup of ipecac. So you can use it for to have a person throw up if you need them to, or if you want it as an antispasmodic, which I've used it as for fomentations, for muscles that were spasming, organs that were spasming. Lobelia is a great tool. If you can use it in a gallbladder liver cleanse, it will dilate the bile duct so you don't have a gallstone to stick. But lobelia is great to help manage coughing. Hydrotherapy. This is the key, guys. Years ago, I can remember years ago, and I hope I'm going to take water breaks here. I hope y'all are drinking your water. Years ago, when I was in school, I was probably a freshman in college. There was an old man. He was about 97, 98 years old. And he said, Walt, I need to tell you something. He says, you're going into healthcare. You may need this information that I have. He said, back in World War I, in 1917, 1918, he said, we had the Spanish flu. He said he was a nurse in the United States Army, and he said we had many men and women that were dying because of the influenza. And he said the only thing that the Army could find that would work for the influenza, especially the pneumonia, was hydrotherapy, hot and cold fomentations to the chest. You can even do chest and back as a revulsive treatment. It's amazing. As I worked with folks with COVID, with pneumonia, COVID pneumonia, this is a tremendous tool for helping with pneumonia. I have a good friend. He's a physician down in Georgia. His wife had pneumonia. This is what he used to cure her pneumonia. You can also use a mustard plaster. Now, mustard plaster, be careful. You cannot use a mustard plaster on someone less than 3 years of age or a geriatric patient who has dementia. The reason for that is a mustard plaster gets hot and it can burn a person. So you do 1 part mustard, 3 parts whole wheat flour, mix it up, add enough water to have the consistency of pancake batter. I'll go and put it between 2 pieces of cellophane, roll it out 1/8 of an inch, pull it back, make it big enough to go over the affected area, put it over the lungs. You can do front and back at the same time. 10 to 20 minutes. You do not know the heating units on mustard, and so mustard can burn. It can blister and permanently scar a person if you don't pay attention. That is why we do not use it on children under 3 or patients with dementia, because they have to tell you it's getting hot. And you don't say, well, Walt said to do it, 10, 15 minutes, and you were only 5 minutes in. No, stop. If they say it's hot, take it off, because it could be a hot mustard and you don't want to blister that person. Stress and anxiety. That's a huge issue out there today. People are going nuts. There are people who just scream to scream. It's insane. What do we do for stress and anxiety? Number 1, exercise. Exercise lowers that cortisol. It's an excellent tool to help that person get that cortisol down. B complex, a doc back in 1978, Florida hospital, years ago, told me, he says, Walt, if you want to help your patients with stress and anxiety, the best tool I've ever found is B complex. You can use a B complex 100, use 1 each meal. It seems to work a little bit better with food or waters. Some people, it can bother their stomach a little bit taking it without food. It's a great tool to help with stress and anxiety. Lithium orotate, tremendous tool. I learned about this one from Dr. Neil Nedley. Lithium orotate is not the lithium that we used to give our patients, 300, 600, 1200 milligrams. That's a synthetic. This is a mineral that's it's an element that's in the ground. I was in last week. I was in where was I? I was in Winnipeg, Canada, speaking, and I stayed at a home. The lady was from Russia, and she said that they have lithium springs over there. And I knew they had them over in Europe. And she says you can drink the water. You can get, have y'all ever heard of going to a mineral spring, hot mineral springs? Well, in Europe, they have lithium springs, and that transdermally goes in and just calms you. Magnesium, tremendous tool for stress and anxiety. Go to bowel tolerance. Lavender essential oil. These two guys are amazing for stress, but really good for anxiety. Well, you can see, I could tell you story after story of people I work with who come in with anxiety, about to blow up like Mount St. Helen, or having a PTSD attack. They'll put one drop of lavender on their wrist where you take your pulse, rub it together with the other wrist, put one drop of the vetiver, put that on there, rub it together. The vetiver has it's very slow dropping, like a 5-weight motor oil, but you rub them together, it will transdermally go in the blood. Then you go breathe your wrist, and usually within 2 to 4 minutes, anxiety is significantly gone down to nothing. I had a girl one time come in. She was about to explode. In 2 minutes, anxiety was gone. And she said, "What did you just do to me?" I said, "No, it's what God just did to you." Do you see how that works? How you can take that and slip in to that person and say, "Jesus just did this for you"? Don't take the credit, y'all. If you do, you'll fall and bust your nose, because you can't do nothing. It is God who does it. And it's kind of like in the operating room. The surgeon is doing the surgery. You're just the scrub nurse who says, the surgeon goes, scalpel, sponge. God says, B complex, lithium orotate, magnesium, hot and cold fomentation. He tells you what to do, and then you do that for that person. He is the one who's doing the work. But lavender and vetiver essential oil are phenomenal on helping with stress and anxiety. Rest is another one. A lot of times people aren't getting their rest. You've got to have rest to deal with stress and anxiety. And don't forget, the hours before midnight were twice the hours after midnight. Harvard University has found that we need to be to bed by 9 o'clock at night. Between 9 o'clock and 10 o'clock, the brain does a deep clean. Its lymphatic system. We did not know that the brain used to have a lymphatic system. It's called the glymphatic system. About 9 to 10 o'clock, it does a deep clean. From 10 o'clock to midnight, it does a thorough clean, but you better be asleep to let that work like it should. Kidney stones. Now you can see why it hurts so bad. Number 1, lemon water. Put lemon in all your water, force fluids, and just squeeze some lemon in there. You want to force those fluids. Hydrangea root is a great tool. It will bust up the stone. Gravel root will help to flush out the stone. And then I use a product called Stone Free. It's a combination of different herbs. It's a great tool to use for kidney stones. Strains and sprains. Hydrotherapy. You want to do, if it's a strain or a sprain, if at first you can, for the first 24 hours to 48 hours, you only want to do cold, but you only want to do cold for 20 minutes, because if you do cold more than 20 minutes, then you have the same, then it changes physiologically to what happens with hot water. So you want to have that vasoconstriction with the cold. But if you go over that 20 minutes, it then starts the opposite with that vasodilation. As the blood comes to the area, starts warming the area, and now you start having that vasodilation. In that first 24, 48 hours, you do not want that to happen. You can put a compression bandage over the strain or sprain, elevation, rest. And then after the 24, 48 hours, you can go to the hot and cold, 3 minutes hot, 30 seconds cold, 3 minutes hot. Excuse me, 30 seconds cold. And do that for, I like doing 7 times. Do it multiple times a day. Excuse me. You can do an ice massage. Some water here. With an ice massage, you take a styrofoam cup or paper cup, fill it with water, freeze it, just tear off about an inch around the top lip, put water on it, and rub it on the area. That works very well. Far infrared is another great tool that you can use after the 24, 48 hours. Far infrared changes the water molecule in the blood cell to where you have better perfusion. And so you're going to increase circulation. Perfect health is perfect circulation. Remember that, y'all. Inspiration tells us perfect health is perfect circulation. And so the far infrared is going to increase the circulation. It's going to increase that perfusion more than just a regular mid infrared or near infrared, the far infrared. We can't see the red. Insects can see it. It's amazing. We use far infrared for bone healing, for it's just many things. Cardiologists use it. It's a great, firefighters use it. Great tool to use. Arnica, it can also be used. Anti-inflammatory herbs can be used. Bromelain, MSM, and Curcumin. Great anti-inflammatory products. Sunburns. Number one, you want to cool the affected skin. Apply a cool wet towel. Apply a washcloth soaked in vinegar. Now, you're not drinking this vinegar. It's not getting into the digestive system, but it's a great tool for sunburns. You soak that washcloth in vinegar, lay it on the affected area. The washcloth's going to get hot. Put it back in the water. You keep going. The vinegar. That vinegar is going to get hot. Get another bowl of vinegar. Put the first one in the freezer, and you keep rotating those. And you do it until your washcloth does not get hot. At that point, put some aloe vera on it, and then maybe another 30 minutes, an hour, it's going to get hot again, and you want to do it again. Always remember, burns, sunburns, or any kind of burn, it keeps burning for 12 hours. And that's what they taught us in school. So you got to cool that burn as quick as possible, and that will shorten the burning time. That's why at 12 o'clock, 1 o'clock, 3 o'clock in the morning, folks are really cooking, hurting, because it's taken all that time to really, really heat up, and the person didn't do what they needed to do to cool. Take a cool bath with baking soda. Apply aloe vera as needed. A great, great tool for sunburns. Probably one of my favorite. I like doing the vinegar and the aloe vera. Drink extra water. Very important for sunburns. You need to have extra water. Do not break the blisters. Why? One, it's going to hurt. Two, you're going to open it to infections, and you don't want infections. As the skin begins to peel, keep moisturized. Burns. This is just basic burns. There's all kinds of burns, different degree burns, but we'll just talk in general here. One, this is huge. Apply lavender essential oil. If you have a burn, the first thing I want to do is just fill that area with lavender essential oil or helichrysum essential oil. And this last one, I have a hard time pronouncing it, but Astyptodyne, great another product that also works for burns. Those are the top three that I recommend that you initially put on a burn. Cool the burn. Place under cool, not cold running water, or apply a cool, wet compress until the pain eases or stops. Do not put ice on the burn. Remove rings and tight items. Again, a medical missionary, you may be working with people that dress differently or have different lifestyles than you. You may come up to a drunk. You may come up to a person who has overdosed on cocaine. Do you walk off and say, your lifestyle's not good. I don't agree with you. You deserve to die, buddy. No, Christ didn't do that. We don't do that. Don't break blisters. Apply herbs, aloe vera. You can have a grated potato. Potatoes are also an excellent tool for burns. Colloidal silver. Those of y'all who work in healthcare, what do you think of here? Silvadene. That's right. Silvadene we've used for many, many years for burns. Colloidal silver works just like Silvadene. Burdock root, comfrey, calendula or calendula, chickweed, bee propolis, golden seal, marshmallow root. These are herbs that or that you can put on those burns to help with the healing of those burns. Cover or bandage the burn with a sterile dressing. Again, when you want to manage infection here, use something for pain if needed. Wild lettuce is my favorite for pain. California poppy, a Jamaican dogwood, skullcap. Those are great tools. Either combination. Skullcap I mix with the wild lettuce, California poppy, and Jamaican dogwood. It's a nervine. It just accelerates the effect of the wild lettuce, California, and Jamaican dogwood. Curcumin. Watch for infection. Mouth sores. Number one, with mouth sores, you want to investigate possible digestive problems. Because usually mouth sores are something going on in the gut. Yes, you can treat the mouth sores, but they're not going to go away until you fix that digestive problem. Salt water can be used. Pine sap can be used. Aloe vera can be used. Myrrh gum powder can be used. Actually, activated charcoal can be used in some cases. Bee propolis can be used. Yep, here's the activated charcoal. Toothaches. This is the top one. Your dentist knows about it, and that's clove oil. Charcoal poultice. Salt water. Salt water actually changes the chemical component in the mouth where it actually slows down the chemical process that causes pain. It's quite interesting. You can do oil pulling. My dentist is a huge believer in oil pulling. You just take olive oil, swish it in your mouth for about 20 minutes. And then you can spit it out. Don't spit it in the sink. It clogs your sink over time. Spit it in the trash can. Go out and spit it out in the yard. Golden seal, myrrh, pine sap, calendula. Another one, sore throat. This time of year, my favorite is slippery elm. Take a glass, put a teaspoon of slippery elm in there, stir it up, and just kind of, you can gargle it. You can slowly let it go down the throat. And slippery elm is the best thing I found for sore throat. You can use honey and lemon. You can just use honey. Bee propolis is another sore throat tool. Salt water, colloidal silver, aloe vera. Good tools for a sore throat. And then hydrotherapy. Y'all are very familiar with the throat heating compress, where you take a handkerchief, fold it, put it in ice water, put it around your neck, and then put a little safety pin, put a piece of plastic around it, and then put a wool sock around it. And then that cold then causes the heat to come to the area, which increases circulation, which the increased circulation causes healing. Strep throat, we see that a lot. The best tool for strep throat, take 8 ounces of water, put 1 teaspoon of golden seal, make an infusion, and gargle that for 2 minutes and swallow every waking 2 hours. Normally, strep throat is gone within 24, 48 hours by doing that. It's an amazing tool. You can use colloidal silver, Alimed, ear infections, golden seal in olive oil. So what you do is you take a teaspoon, fill it about 70% full of olive oil, put golden seal, enough, maybe around a third to a half of a capsule of golden seal. Mix it in there. You don't want it too thick. You still want it to drip. And you don't want it to get too thick that it just cakes up in the ear. And put in a young child, I'll put 2 drops every waking 2 hours. And an adult, I'll do 3 drops every waking 2 hours. And then, you know those things guys use when they go hunting, and it's hot hands, and they put it in they pop it, and they put it in their pocket, and it warms their hands. You put one of those on their ear, and then you put a little boggin or a little hat on their head to hold that on the ear. And then every 2 hours, you take that off, put more, 2 or 3 drops, depending on size, in the ear, rub it like you'd rub something down in a dog's ear, and that will get in there. And then that heat works very, very well for an ear infection. You can do candling, also another good tool for ear infections, garlic oil, a light bulb. You can hold a light bulb off the ear about 2 inches. That's a tool I learned from Dr. Agatha Thrash. Far infrared, do the same thing. Hold it off the ear, but with far infrared, depending on the size of the lamp, you're going to do it on a small lamp, 4 to 8 inches, on a large lamp, 11 inches. Eye infections. Golden Seal is my favorite, Golden Seal tea. You take, I'll take an eighth of a teaspoon of Golden Seal and put it in a 1 ounce container and add 1 ounce of hot water and make a little tea in that 1 ounce little container. It's like a little shot container. And then you get a coffee filter. It's the only thing you should have a coffee filter for. And because a paper towel wicks up too much and you lose too much of your material. And so you pour it gently in that coffee strainer. That's going to stop all those little granules from the Golden Seal powder. You want just that Golden Seal tea. And then put 1 to 2 drops in the ear. Correction, in the eye, apologize. 1 to 2 drops in the eye. And you can do that, every couple hours. I had an eye infection several months ago, and it was my fault. I had a contact that I had taken out, didn't thoroughly clean it, put it back in, and I had an eye infection. And took the contact out, put 1 drop, all I merely put it in, 1 drop, and it killed the eye infection. Honey, you can use honey in the eye for an eye infection. Colloidal silver, you can put colloidal silver in the eye. And then this is a good tool. And those of y'all from the Caribbean, from Africa, from other countries, a lady many times, as she nurses her child, that first 3 to 6 months, she squirts breast milk in their eye at least once a day. That's prevention to keep that child from getting an eye infection. Well, if a person has an eye infection, you can find human raw milk, cow or goat milk. You can put that in the eye and it will stop that infection. The charcoal poultice, scratch eye scratch. The best tool I've ever found was vitamin E oil. Just put 1 drop of vitamin E oil in there, and it works amazing for a scratched eye. You can use Golden Seal tea, honey, colloidal silver, pink eye. Again, my favorite is Golden Seal tea, a saline solution. When I was raised up on a farm, and my dad would go and we might buy some cattle, and some had pink eye. He'd just go and toss salt in the eye. Well, you don't go tossing salt in people's eye, human eyes. Excuse me. You can do a saline solution, and saline solution you don't have to buy. You can make your own. Saline solution is 1 pint of water to one pint of distilled water to 1 teaspoon of salt, and that makes normal saline. Colloidal silver, again, raw milk, charcoal poultice for pink eye. Pain. One thing you want to look at whenever you have pain, water dehydration significantly exacerbates pain. Read Dr. Batman Jotty. He's probably the best I've read. His book, Your Body's Many Cries for Water. Excellent tool. If you're dehydrated, it will increase or magnify your pain. If you've got back pain, knee pain, arthritis, dehydration will magnify it. The wild lettuce, California poppy, Jamaican dogwood, curcumin, white willow, ice massage. Also, you can do that for that pain. You can add the skull cap in there as a nervine. This is the last one we'll do. We've run out of time. Angina. That's the pain you get when you're having a heart attack. Cayenne pepper is the best thing I have found for angina. You can take the liquid, squirt it under the tongue, just the powder, put it under the tongue. I have men that come to me and buy the cayenne pepper liquid, the extract, tell me it works far better than nitroglycerin. Far better than nitroglycerin. It's a vasodilator. Lifestyle. These are things that help to prevent angina then, but I attack it with the cayenne pepper because you're going to have problems. They need to quit smoking, CoQ10, L-carnitine, start exercising, and reduce stress. Well, y'all, I think we're out of time. Any questions?
Thank you so much, Brother Cross. That was absolutely wonderful information. I see one hand raised. I think I will go through the few questions that are in the chat first, and then we'll take the hands. So we have a question here. Do you need a carrier oil in order to use the lavender oil? Do you
No, you
recommend
don't.
using?
Good question.
Okay.
Some, it depends on what you're using it for. You can use it. Excuse me. One of the problems with essential oils, you can have 92, 93% evaporation. And especially if you use something like frankincense or helichrysum, which are very expensive. And that lavender, that carrier oil it helps as a driver, and you don't have as much of the evaporation, but sometimes you want that impact of that very concentrated. And so I don't. You can, but I don't. Now, if it's a hot oil like clove, or I mean, like some of the oils, you can't use a hot oil on your skin without a carrier.
All right, great. We have two comments here. Someone said they have used myrrh during COVID as a gargle, and that worked well for them.
Yes.
Someone else used mullein oil for an ear infection.
That's good.
So I'm seeing where their persons are using the natural remedies and they are working. Another question is, can you use the golden seal extract for an ear infection?
You can. You can use the golden seal extract. I'd probably, the extract is probably going to be with vegetable glycerin. It should be fine.
Okay, great.
Now, let me explain here real quick. You've got tinctures and you have extracts. Tinctures have alcohol. Extracts use vegetable glycerin.
Good distinction there. All right, so what can be done for migraine? I don't think you touched on migraines. I don't know if you have.
I didn't get to that. So for a migraine headache, the best thing I have found, I was in, where was I? I was in Bermuda doing evangelistic series. I was doing the health component with the evangelistic series. And there was a lady who had come in. She had told me that she had migraines. Well, after one of the meetings, I'm starting to walk out, and there she is laying with her head between her legs. And I walked over and I said, "Are you okay?" She says, "I can't move." She says, "My migraine is so bad, I can't move." And she said, "I left my migraine medicine at home." And so I had two ladies go, and one get a bucket of hot water and the other one get a bucket of ice water with two washcloths. They put her, well, first we prayed. Then we put her feet in the hot water, a vasodilator. We put an ice pack, a washcloth cold here, a washcloth cold here. And then you get a pitcher of water in a cup and have them drink 8 ounces of water every 10 minutes. Now, normally you don't do that because you're going to have free flow if you drink anything more than 2 to 3 ounces of water at a given time. It just goes to the kidneys. But on this situation, we want to just keep that drinking there going. And within 20 minutes, this lady said, "I can move now." She got up and she went home. That's the best thing I have found for migraines. Now, obviously, you can't go and just carry a chair and water with you everywhere you go. So you can use things like butter burr. Butter burr is a great tool for migraines. Sometimes you can use lavender essential oil. You can use peppermint essential oil, but be careful. You do not want that essential oil to drip into your eye. It will hurt. The key is you want to find out what is the cause of the migraines. Is it because you're dehydrated? Is it because you're constipated? Is it because you need an adjustment? My son gets migraines about every 2 months, and he'll go to the chiropractor. They'll adjust his neck. Within the time he gets back to the office, migraine's gone. And he's good for another, 2 months and sometimes 3 months. And so if you've been sitting in the wrong position or whatever, you just may need to get an adjustment where you're having an impingement there. on a nerve. So you want to find the root cause. You could have allergies. It could be because your glasses, you need a new prescription, or that you don't have glasses and you should have glasses. There's a number of reasons. Always get to root cause.
Absolutely. All right, so good information there. Moving on, I'm not sure if you have, I don't know if we want to go into new topics per se, since as the time is gone, I think we want to steer the questions towards the information that Brother Cross gave. But I'm seeing here what can be used for H. pylori and for thyroid nodules.
Okay, so H. pylori, the best thing I know, over 50% of the world population has H. pylori, Helicobacter pylori, and it looks like a little, when you look at it, it looks like a little corkscrew and is conscrew into the mucosa, and it can cause ulcers. You want to get rid of it. Many people will address stomach problems, but they don't get rid of the H. pylori, and so it won't get rid of the problem. And the best thing I have found is Alimed. You can take 1 teaspoon twice a day of Alimed for 45 days with a probiotic, and that will wipe it out usually. That's a great tool for H. pylori. For the other item was, what was the other item?
So H. pylori and thyroid nodules.
Thyroid nodules. Best thing I found for thyroid nodules is using 12.5 milligrams of iodine. But you want to find out, is that person hyperthyroid? If they're hyperthyroid, you want to be careful giving the iodine. If they're hypo, it's probably not going to be a problem. But if they're hyper, which means you're less than, it used to be 0.4, now it's less than 0.35, you want to be careful on taking the iodine. But iodine is the best tool I have found for the nodules. Now, there's a lot of stuff we could talk about thyroid, but nodule specific, that's what I use.
Great. All right. So we're seeing lots of commendations, wonderful presentation, amazing information, and someone requested for you to place your information in the chat, or maybe you could just real quick go back to that QR code.
Sure.
And share so persons are able to snap that real quick. The recordings are available on YouTube on the TOC platform, so you can go back at your leisure and view that. So you can just search up Table of Christ Ministry on YouTube, and you'll be able to access the recordings from this evening and previous presentations as well. What can you do for joint pain or knee pain, or if someone has arthritis pain?
Great question. Again, water's number one. Dr. Agatha Thrash, y'all remember Dr. Agatha? Back in 2008, she said, Walt, we got to change what we're doing for arthritis and pain. And she said the number one cause now is the wheat that we're eating. The wheat in Europe has 14 chromosomes. The wheat here in America has 42 chromosomes. Plus, we spray it with Roundup. Can you imagine growing your garden, growing some green beans, and you're going to pick a mess of green beans tomorrow, and you say, oh, you tell your husband, will you go spray the garden with Roundup today? We're going to pick green beans tomorrow. No way are you going to feed your children green beans that just got sprayed with Roundup. But that is what we do when we eat bread, wheat in the United States. Whether it's bread, whether it's crackers, whether it's pasta, you're eating Roundup. You're eating wheat that used to grow about 4 feet tall. Now it's down to about a foot tall because we super hybridized it. Then now we're seeing problems with corn. New research came out back maybe 2 months ago saying that corn is now having the same effect. Why? It's super hybridized. They're spraying it with Roundup. So you want to find the cause of it. And I'm finding for arthritis pain, if a person, and Dr. Agatha said one cracker, just one cracker, wheat cracker, can kick on arthritis pain for 2 to 2.5 months down the road. Just one cracker, one bite of birthday cake. So you want to get to that root cause. What do you do if you want to treat it? I like MSM, MSM, like Mary Sam Mary. MSM comes from DMSO, from trees. And then when we take it internally, it goes back into DMSO, converts back into DMSO in the body. It has many, many benefits in the body, but it's a great anti-inflammatory. Start off with 1 teaspoon twice a day for a week. Go to 2 teaspoons twice a day. But there's 2 very important keys with MSM. You cannot put it with water that has chlorine in it because chlorine neutralizes the MSM. You cannot put it in the stomach or in any kind of liquid that has citrus in it. So because it neutralizes the MSM. So if you want to take MSM in the morning, take it about 30 minutes before you eat or you drink your orange juice or eat your grapefruit or whatever. But MSM is a great tool. 1 teaspoon twice a day, first week, 2 teaspoons, 2 teaspoons twice a day, second week their own. I have farmers that take as much as 2 tablespoons twice a day because they have so much. It can take 3 days up to 3 months to work, but it works very well. Curcumin, it's a product called Curcumin by Terry Naturally. It's curcumin, and it's very, very strong. Terry Naturally has found a way to use curcumin essential oil instead of black pepper to make it work, because we're concerned about the black pepper. Don't have that in Terry Naturally's product. So there's several tools you can use. I like far infrared. I'm having very, very good benefit with people sitting in a far infrared sauna for 20 minutes every day. And the pain significantly reduces in their hands, in their knees. And then another problem we see with knees, I used to be 200 and some pounds, and I had terrible knee pain on my left knee because of sports in school. And Mary Lou says, you gotta lose some weight. And I lost weight. I lost 50 pounds in 3 months by not eating supper, not eating past 3 o'clock. I ate breakfast, I ate dinner, but I didn't eat past dinner being the noon meal. I didn't eat past 3 in the afternoon, and I lost 50 pounds in 3 months. Pain went away. I don't have that pain anymore unless I pick up something really heavy, like a 50-pound bag of wheat, or not wheat, but corn or whatever, throw it on my shoulder and carry it upstairs. I got that pain again.
Absolutely. That weight, I can attest to that too. Whenever I put on a little weight, I can feel a difference in my joints. Someone wants to know if the cartilage in the knees will grow back.
They've tried that. They were using the the rooster cone. It didn't, that Duke was doing it, and they had high hopes for it. They found it doesn't really work. I'm not finding there are some things that help cartilage growth, but it is not total vegetarian. So I do not have at this time a good non-animal product to use.
Right. And the cartilage is because of the poor blood supply to the cartilage based on the structure, it usually does not regenerate. So that's a little challenging. All right. Someone wants to know the name for H. pylori. It's Helicobacter pylori.
Yes.
The bacteria that grows in the stomach there. I think I'm gonna take this as the last question, and then take the hand that is up, and then we'll cut off for this evening, because we're 15 minutes past the hour, and we want to be temperate.
Sister Camille?
Yes. Sister
Real
Rhonda?
quickly, before we go further and close out, Brother Walt, thank you so much. Do you have a disclaimer for anyone here? Because not everyone online right now is a medical missionary. Is there any disclaimer you want to give to everyone who is listening to the health advice, health tips?
I do. As a disclaimer, I'm not a medical doctor, and I'm an educator. Take the information, and this is very important, y'all, medical missionaries. You're educators. Give people information to make an informed decision. Then go talk to the medical director. That's God. God is the medical director. And say, God, this is what I've looked at. What do you want me to do? We do it when we go buy a car. We say, God, is this the right car to buy? Or is this the right house to buy? And you go, I don't feel right. No, I ain't getting that car. Or I really feel good. I feel God's impressed me. Buy this car. Same thing here, or in any decision you make throughout the day. Ask God what you need. Don't just pray in the morning and at night or when you have your blessing. Talk to God all day long. That's important. And so what I've shared tonight is just, it's education. It's stuff that works. Talk to your medical advisor, whoever your medical advisor is. And God is the number one medical advisor.
Right. And Brother Cross has been working in the healthy lifestyle field for a while, and experience does teach wisdom. So I'm sure a lot of the information that he has shared with us tonight is from experience, the lived experiences too. All right. So seizures that occur within a 9-year-old usually one per year. The CT was negative and no other related illnesses. Someone would like to know if you have a recommendation for
So with
that
the CT,
9-year-old.
with the CT being negative, it sounds like there's no tumor. You want to rule that out. And once a year doesn't sound like epilepsy. There's various things that causes seizures. There's different kinds of seizures. Usually stress exacerbates seizures. Does that parent find that stress, was that child in a stressful situation when that seizure came on? So address stress, minimize stress, manage stress. And that way you can help. B complex, lithium orotate, magnesium, those things we talked about, trace minerals. There's a lot of things you can do for stress. Then there's what I have found to work the best for seizures. It's called Copaiba. Copiaba. Copiaba. Copaiba. It comes out of Brazil. It's a tree. It's tremendous. It is the most anti-inflammatory phytochemical that has been identified in the world. So if you're wanting a good anti-inflammatory, Copaiba is excellent. It comes from a tree, usually 30 to 50 years old, and they tap it like a maple tree. They're very careful because they don't want to, they protect those trees. And talk to a Brazilian; they'll tell you all about Copaiba because it's been used for centuries for medicinal benefits. So I had a guy come in. He had it was an epileptic. He had seizures many times. He'd fall off roofs. He was a construction worker, contractor actually. He had to quit driving, quit working, and he's now been right around 2 years seizure-free by using the Copaiba. Other people, Parkinson's, we've seen benefit. We've seen benefit in, especially in essential tremors. I would look at Copaiba as but here's the thing. If it's only once a year, here you are taking this every day for a whole year. I mean, it's not going to hurt you, but try to figure out what's the cause and eliminate that cause or minimize that cause.
Right. So you want to, and the recommendation for seizures too is that you try to take a note of what's happening around that time of the year, right, and so on, as Brother Cross indicated. Write that down. Is it a particular time of the year? How long does it last, and so on? And what are the circumstances around the seizure? And then you can track it that way. So thank you for that. That was good information, Brother Cross. Motorola Edge. Could you please just introduce yourself? State who you are, because I'm not seeing a name here. Really, I should ask for a name change, but since you're the only hand up, I ask you to go ahead.
Hello. Yeah, my name is Dean Simmons and my wife, Shireen Simmons. So my question was, it has something to do with the salt, because I heard other medical missionaries, or they were mentioning using salt to wash out the mouth when you have sores or when you have a sore throat or that sort of thing. And of course, my understanding automatically goes toward the sea salt or something like that. But would regular table salt suffice as well, or should I just continue to go toward the sea salt, Himalayan?
The table salt has been used for many years for that type of thing, washing out. And I personally like using the sea salt better, or the Himalayan salt, or the real salt. But for many years before we got into sea salt and that kind of thing, the regular, Morton salt was used. But I warn you, when you look at using salt by mouth, it's the little girl with the umbrella that will kill you. It's that Morton salt that you want to stay away from. Go with the Celtic salt. Go with the sea salt, the pink Himalayan salt, whatever. I'd rather use those. They have more mineralization, more nutrients in them. But if you don't have anything that you're using to wash something off, and you can use the Morton salt, but because they've used it for years and it worked.
True. Okay, thanks.
All right, great. So I did say the last handbooks. I see someone with their hand up. The person is M. Could you please state your name? And go ahead and we'll take you as the last question. Thank you.
Good evening. My name is Marjorie. I would just like the name to be repeated, please, for what he said can be used for H. pylori. I didn't hear clearly.
The Allimed, 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 like MRSA. It blows the doors off vancomycin. It's amazing, far better than Vanc. But it's Allimed, Allimed. It comes out of England. It's stabilized garlic. It's the only company in the world that has been able to really truly stabilize the garlic. And it's stabilized. It's been proven for at least 2 years. We're looking at research now as much as 5 to 7 years, but it comes from England.
All right, great. Thank you for that. And thank you for your questions. I'm seeing where someone called for a part 2, but I think this is part 2. I'm guessing a part 2 of this series so that we can finish the other 50 something slides. It was such a pleasure listening to you. I learned a lot. I'm sure everyone on learns a lot too. It was really a pleasure for you to be on. Rhonda, I don't know if you have anything that you would like to say before we close off.
Amazing, absolutely amazing. As medical missionaries, we are so very grateful for this information. And yes, hopefully, Brother Walt is extremely busy. I was told by his son that he's booked all of next year already. And
Wow.
we're hoping and praying that he could come back. So we will definitely love to have you back. And thank you so very much. May God bless you and your family and your ministry. If there's anyone you've been asking a lot of questions, you can consult with Brother Walt. Just reach out to him at the Mustard Seed, make an appointment, and I'm sure you can consult with him there, right, Brother Walt?
Yes, ma'am.
Wonderful. Thank you so
Yes.
much. It
Okay,
was a
so
pleasure having you all. Rhonda, is there someone
yes,
that's going to
and
close out in
you're
prayer?
always welcome at Table of Christ Ministry.
Thank you.
All right, let us close out in prayer quickly. Father God, we just thank you for the leading of the Holy Spirit and how you have blessed Brother Ross with this information that he could have shared with us. I pray that, Lord, you will put it to good use and that you continue to bless his ministry. May it grow from strength to strength, and may we go forth and empower your people, we pray. Thank